My name is Adele Costabile. I'm a reader in nutrition at the University of Roehampton.
So my name is Stephen O'Hara. I'm the founder and CEO of ProBiotix Health plc.
When we're talking about probiotic, we can see so many studies that show how probiotics are so important for our health. However, we cannot say that all probiotics can have the same effect.
Most probiotics that people are aware of have general health benefits or have gut health benefits, and often the mechanisms of action behind those particular probiotics aren't really fully understood. Lactobacillus plantarum, or as we call it, LPLDL, is unusual both in terms of our understanding of it, in terms of its mechanism of action, and the fact that it impacts upon particular biomarkers of cardiovascular risk. We have a number of scientific and clinical studies. The scientific studies help us to understand the mechanism of action in terms of how the probiotic works. And that's important because then you can optimize the dose and use of the product. In terms of the clinical studies, we've had 3 studies. One initial study was carried out at Reading University, which looked at a group which had normal to mildly elevated levels of cholesterol. That's important because clearly you don't want to reduce cholesterol in patients who have normal levels of cholesterol, because cholesterol is important. And that was able to show that when people have normal levels of cholesterol, there was no effect, and the higher the level of cholesterol, the greater the effect. The second study we carried out was at the University of Pavia in Italy. What we found in the first study, as well as reducing cholesterol, we had a reduction in blood pressure. So we worked with an Italian partner to create a formulation that was uniquely designed to reduce blood pressure, which contained LPLDL. Finally, we've had a study that we carried out with the University of Roehampton. And that was carried out in patients who had high levels of cholesterol.
I was the principal investigator of both studies on LPLDL. We were asking the study participant to not take any drug that were impact on the lipid profile. Each participant were monitoring their normal dietary habit along the study, but also they were recording in case of any compliance or adverse event. This study was a double-blind, so neither the participant nor the researcher knew if they were taking the active LPLDL or the equivalent placebo.
The separation between the placebo group and the test group I thought was one of the best separations I've seen in any study.
This is the first study that have shown that after 3 weeks, study participants with high cholesterol, they had a significant reduction in blood lipids biomarker. After 6 weeks, there were seen a further reduction in total cholesterol. There
are products out there currently, typically statins and other products, but cardiovascular disease is the world's biggest killer. So there needs to be an alternative, there needs to be another option. LPLDL is that other option. We think we've got a very interesting and very exciting product here.
This probiotic have shown in patients with high cholesterol at the baseline a significant reduction in these key biomarkers related to cardiovascular disease. After 6 weeks, this, especially total cholesterol, was further reduced to the normal level in individuals.
It can be used by customers who have rising levels of cholesterol, and their clinician advises that they may have to go on to statins unless they can alter their lifestyle. There's also quite a large number of patients who are on statins who suffer from tolerance and poor compliance. So LPLDL can fill that gap in those patients who are statin intolerant, who cannot take statin for other medical or ethical reasons. There's the possibility of using LPLDL in combination with statins to allow the physician to reduce the dose and so reduce the side effects.
During this study, we didn't report any adverse event. This probiotic was safe, easily to use, and was showing significant reduction after 3 weeks.
This doesn't just work in clinical studies, we have seen that the reductions in cholesterol that we're finding in clinical studies are being mirrored by our customers in the field.